Welcome to Anatomy and Physiology class, the best channel to explore the wonders of human body. If this is your first time to visit this channel, like, subscribe, turn on notification and follow all our social media accounts to get more updates on our programs.
Introduction to Anatomy and Physiology. Remember, as we earlier said, this introduction or this tutorial is for the first category of students that we had already introduced, which are the community health extension workers, pharmacy technicians, medical lab technicians, X-ray technicians, and other courses or students that are struggling for diploma courses like these courses that we have just mentioned. So now let us just dive into the content of the course. So firstly, we are going to see the introduction, anatomical terms, organization of the human body, anatomical position, body cavities, resonance of the body, homeostasis, body fluids, then mechanism of regulation of the body fluids. Where we are going to talk about diffusion and osmosis. So introduction. Anatomy is the study of structures and their relationship to one another. So anatomy is more concerned about how the structures are, how do they look like, how can we study the structures. So anatomy is more about all this, while physiology is more about studying the functions of the body. So what are the functions of those structures? How does those structures carry out their functions? So physiology is more concerned about functions. So anatomy has so many branches, but the main branches of anatomy include gross anatomy, which deals with the structures that can be visualized with naked eyes. Example: regional anatomy, systemic anatomy, and the rest. So just look at these structures. For example, the heart, this hand, the brain, the skull, and other structures that we can visualize them with our naked eyes. So gross anatomy is more about all these structures, the story of these structures. Then we also have microscopic anatomy. Microscopic, when we said something is microscopic, we mean something that we can only be able to visualize it using microscope, whether it's magnifying lenses or higher light microscope or any other type of microscope. And example, we have histology, which is the study of tissues, and cytology, which is the study of cells. So cells can only be visualized using microscope. So microscopic anatomy, we use microscope to explore to further explore the microscopic structures of all those larger structures that we can visualize them with our naked eyes. So we move beyond visualizing structures with our naked eyes by using microscope to see the microscopic anatomy of those structures. And developmental anatomy. Developmental anatomy deals with the structural changes that occur throughout life, starting from the intrauterine life up to the end of the life. But embryology, as example of developmental anatomy, is more concerned about the structural changes or development that occurs in an embryo in the intrauterine life. So embryology is restricted to intrauterine life, while developmental anatomy is beyond the intrauterine life only. So what are the approaches in studying the gross anatomy? How can we approach gross anatomy? How can we study gross anatomy if we want to study? From where are we going to start, and from where are we going to end? So there are so many approaches. One is the regional approach or regional anatomy, which is also known as topographic anatomy. It deals with it's more associated with categorizing the body into different regions and studying each and every region together. Example, let's look at this diagram where the body is divided into so many regions: head, neck, thorax, upper limb, lower limb. So in this regional anatomy, we study the anatomy of each and every region individually. We study each and every region individually, regardless of the part of the structure that is found in other regions which are related to it. For example, the esophagus can be found in the neck, but it extends down into the thorax and the abdomen. So when we are to study the anatomy of the neck in the regional approach, we study the part that is only present in the neck. And we are also having systemic anatomy or systemic approach. In this approach, we categorize the body into various systems and study each and every system individually. So the systemic approach is the study of body's organ system talk together to carry out complex function, which is known as system. So collection of body organs that carry out complex function is what is known as system. So look at this diagram where we are having the circulatory system and the skeletal system combined together. So in the systemic approach, we study each and every system individually, even if that system is not just restricted into only one region of the body. For example, the system started from the head, it extends down into the neck, thorax, where we are also having the esophagus, then the abdomen. So we study all the organs that are related to the digestive system, which are found in any region of the body. So clinical anatomy, it deals with the structural changes that occur in normal that occurs in as a result of pathological conditions. So after knowing the normal structure of the body, if there is any pathological condition, what changes occur to a specific structure. So the clinical anatomy is more concerned about this, and it is more associated to the clinical setting or clinical practice. So just take note that in this tutorial we are going to focus more about the systemic anatomy and the clinical anatomy. So the regional anatomy we are going to apply the regional approach in the subsequent group of tutorials for higher anatomy and physiology student, MBBS students, or for the third category of student that we had to mention earlier in our introduction. So anatomical position. Anatomical position of part of the body position as a person is standing upright with the head, arms, foot facing forward, thumbs facing sideways. So this anatomical position is very, very important because we use the anatomical position in describing the body parts. Even if that part is capable of turning from one side to another in such a way that the location or the position of a specific structure might change from one place to another or from one position to another. So we maintain the normal position of that structure in anatomical position. For example, if somebody turn his hand, if you turn your forearm, definitely the position of the thumb will change from either left or from either lateral to medial, or from medial to lateral, or from left to right, for it to become more closer to the body. So if we are to describe the location of the thumb, we said it is the most lateral finger, because in anatomical position it is the most lateral finger. Even if you are capable of turning it and changing it to become more medial. So we maintain the normal description of the anatomical position. So whenever we said so organ is posterior to so organ, we are talking about anatomical position. So don't get confused. Anatomical terms. Anatomical terms are very, very important because they are the terms that are used in the anatomy and physiology. And remember, anatomy and physiology, some of their terms or most of their terms, they have Latin or Greek origin. So that is why knowing the terms is very, very important, even if English language is your native language. So here are the terms. So each and every term we mention the term and the opposite term and the opposition term, or the term that is opposite to it. So firstly, we are having anterior ventral or rostral. When we said anterior ventral or rostral, it means front. For example, we can say the face is located in the anterior part of the body, which means the face is in the frontal part of the body. We can also say the heart is anterior to the backbone, which means the heart is in the front of the backbone. Then posterior, which is the opposite of anterior. Posterior also means posterior or dorsal. It means back. So we can set the buttocks are posterior to the backbone. The buttocks are located at the back of the backbone, or we can say the buttocks are present at the posterior part of the body or posterior aspect of the body. So superior means top or up. So we can say, for example, we can say the head is the most superior region of the body, or the head is superior to the neck, means the head is higher than the neck, or is at the topmost part of the body. And the opposite of superior is inferior. Inferior means bottom or down. So for example, we can say the neck is inferior to the head, means the neck is at the bottom of the head. Then medial means toward the midline. So we assume an imaginary line that divides the body into two equal halves, into left and right. So anything that is toward that midline, we said it is medial, and anything that is away from that midline, we said it is lateral. So medial and lateral. So medial means toward the midline, and lateral means away from the midline. For example, we can say the heart is medial to the lungs, means the heart is more close to the midline than the lungs. Or we can say the lungs are lateral to the heart, means the lungs are side away from the heart in a lateral manner, or in a manner that is away from the midline. Proximal and distal. So proximal means near the origin, while distal means away from the origin. So we assume the trunk to be the origin of the body. The trunk means this region. Combination of this region is what gives rise to the trunk. Neck, thorax, abdomen, pelvis, and perineum. What gives rise to the trunk. So we assume the trunk to be the origin of the body. So anything that is more close to the trunk, we say it is proximal, while any structure or part of the body that is away from the origin, we said it is distal. So for example, we can say the forearm is more the forearm is more proximal to the body than the hand. Or we can say the forearm is proximal to the hand, means the forearm is more near to the origin than the hand. Just like we can say the hand is more distal than the forearm, or the hand is distal to the forearm, means the hand is more away to the origin than the hand. Then superficial and deep. Superficial means close to the surface. The surface of the body, we are having the skin in the surface of the body. It is what forms the surface of the body. So anything that is close to that surface, we said it is superficial, and any structure that is away from that surface, we said it is deep. For example, look at this cross section of this limb. Here, this whitish structure that you are seeing is a bone, while this reddish structure is the muscle, while this yellowish structure is the skin. So you can see the muscle is more close to the skin. We said the muscle is superficial to the muscle is more superficial than the bone. The muscle is more close, which means the muscle is more close to the surface than the bone, or the muscle is superficial to the bone, means the muscle is more superficial than the bone, or we can say the bone is more deep than the muscle, which means the bone is more away to the surface than the muscle. So organization of human body. How is the human body organized? What makes up the human body? So the human body is organized at different levels, but the first thing that forms the part of the organization body, or the first level of the organization of the human body, is the chemicals, but we didn't mention it here. But later on, in the subsequent tutorial for the second or group categories, or for the second or third categories, or maybe in our Facebook channel, you will see something of that nature. So the first thing that we had mentioned is the chemicals. The chemicals are the one that combine inside in the chemicals we are having atoms and molecules. Atoms are the one that combine to form molecules, while molecules combine to form a cell. So a cell is a combination of different kind of molecules. So cell is the collection of molecules, and here is a cell. Then tissue. Tissue is a collection of similar cells that serve a specific function. So collection of different cells that serve a specific collection of similar cells that serve a specific function is what is known as tissue. So you can see a tissue here. Then organ. Organ means collection of different tissues that achieve a particular function. So different type of tissues combine together to form an organ, while different type of organs combine to form they combine together to serve a specific function or a complex function. For example, digestion of food, it is achieved by the aid of different collection of organs. So different systems also combine to form an organism. So in the organization of human body, we are having chemicals, cells, tissues, organs, system, and organism. So system is the collection of different organism is the collection of different systems. We have the respiratory system, digestive system, urinary system, nervous system, and the remaining systems. They are the ones that combine together to form an organism. Then body cavities. Cavity means a hollow space that contains something inside it. Just a hollow space. It is what is known as cavity. So there are so many cavities in the body that contain some vital structures. For example, we are having the cranial cavity, which contains the brain. We are also having the spinal cavity. Here is the spinal cavity, vertebral canal, vertebral cavity. It contains the spinal cord. And thoracic cavity. Here is the thoracic cavity. The thoracic cavity contains the heart and the lungs. Then abdominal cavity contains the abdominal vessel, the stomach, intestine, and the remaining organs. And pelvic cavity contains some of the urogenital structures like the urinary bladder, seminal vesicles in male, uterus in females, and other structures. Regions of the body. So regions of the body, there are different major locations of the body. The body is segmented into different regions. So these regions include the head region, neck region, the thorax, abdomen, pelvis, perineum. So these regions are more associated to the axial skeleton. Then upper limb and lower limb, these regions are more associated to the appendicular skeleton. They are more associated to the appendicular skeleton or the appendages. That is why you also call it upper extremity and lower extremity. So the perineum is just the region or the part of the body that contains the external reproductive organs or external genitalia and the anus. So that part, it is what is known as the perineum. So the neck, thorax, abdomen, and pelvis, it what give rise to the trunk. So when we say trunk, we mean the combination of these regions. So homeostasis. So physiology is all about homeostasis. Homeostasis is the maintenance of constant internal environment. Maintenance of the internal environment in a constant manner. The internal environment composed of the fluids or the substances that are found in the internal part of the body. Those fluids or substances that are found in the internal part of the body there are some certain level that we try to maintain them in such a way that exceeding that level or having higher content of those components of the internal environment may lead to abnormality. As such pathology may likely occur. So also having lower components or lower content of the components of the internal environment may also lead to abnormality. So that is why we try to maintain them in a stable manner. That is why homeo means same, stasis means standing opposite of movement. So physiology is all about homeostasis. It's trying to maintain the constant internal environment of the body. So what is the role of homeostasis? So these are the roles of homeostasis: maintenance of water and electrolyte balance. The water of the body, the water that is present in the body, and the electrolyte balance supposed to be maintained in a constant manner in such a way that if the water is lower than the electrolyte balance, definitely that will affect the rate of diffusion or osmosis, and that will also damage some cells. So also when the level is higher or lower. And oxygen, maintenance of normal oxygen, because oxygen is very vital for different metabolic activities. Different metabolic activities are in constant need of oxygen for them to occur. So that is why maintenance of normal oxygen level is also very good and important, and it is one of the role of homeostasis. And hormones, there are different hormones. Hormones are chemical messengers. Hormones are chemical messengers that induce cell signaling. There are different hormones that are responsible for different metabolic activities, where these hormones are the ones that are responsible for activating different metabolic activities in the body. They are the ones that stimulate different metabolic activities or different regulations in the body activities. That is why maintenance of the normal hormonal level is very, very important. As such, if there is hypersecretion or hyposecretion of any hormone, that may lead to a specific abnormality, where we are going to see that in the endocrine system. The maintenance of the normal pH. The normal pH of the body is slightly alkaline. So 7 is neutral, anything below 7 is acidic, and anything that is higher than 7 is alkaline. So since here we are having 7.4, we say it's slightly alkaline. And this slightly alkaline pH is very, very important for different metabolic activities, different enzymes to act in different metabolic activities. That is why this normal pH is also very, very important for it to be maintained in the body. And optimum temperature. The body needs a warm temperature for so many metabolic activities to occur. As a result of that, if the temperature is very, very low, the body will end up struggling to raise the temperature, thereby having so many abnormalities if that is not successful. So also when the body temperature is very, very high, definitely fever or any or other abnormalities may likely occur. That is why optimum temperature, a suitable temperature that is suitable for metabolic activities to occur, is very, very important, which is 37 degrees Celsius. The normal BP. So remember, the body fluids, one of the body fluids includes the blood, which we are going to see that in the subsequent part of this tutorial. So that blood pressure, the pressure that is exerted on the arteries after the blood is pumped by the heart, that pressure is very, very important, because that pressure is very, very important because having that pressure to become very, very high may likely lead to hypertension, and when the pressure is very, very low may also lead to hypotension. So any abnormality that is affecting this blood pressure may likely affect the rate of diffusion of substances from the blood to body tissues. That is why maintenance of the blood pressure is very, very important, where we are having 120 for systole and 80 millimeter mercury for diastole. So nutrients. Nutrients are the fuel, are the body fuel, which are responsible for generating energy that will be utilized by the cells in performing different metabolic activities. So that is why nutrients are very, very important, like the glucose, amino acid, lipids, and other fatty acids and other type of lipids, why we are going to see them in digestive systems. They are very, very important, because without this nutrient, definitely the cell will not be able to serve their functions, because there will be nothing like generation of energy that will be used in those metabolic activities. Just assume your car without fuel. So body fluids. So body fluid is formed by combination of different solids and fluids. So the fluid here is water, while the solids are the components of that are the remaining components of that very fluid, where they may likely be organic or inorganic in nature. So the total body water in adults of an average build is about 40 liters. An average adult has about 40 liters in his body, 40 liters of body fluid in his body, and that is about 60% of his normal body weight. So types of body fluids. There are two major types. We have intracellular fluids. Intra means inside, cellular means cell, fluid means water. So the fluid inside cells is the intracellular fluid, and this is not categorized into so many other fluids, but just take note that, remember, okay, maybe we didn't reach cell, but as we reach the topic of cell, we will observe that inside the cytoplasm there are cell organelles and cytosol. Cytosol is the fluid that is found inside the cell. We are going to discuss that when we come to cell. Then extracellular fluid is the fluid outside the cells. The fluid outside the cells is the extracellular fluid, and it includes the plasma. Plasma is inside the blood, interstitial fluid, the fluid in between tissues, cerebrospinal fluid. Cerebrospinal fluid is found in the CNS. It's found in the regions where we can find the CNS inside the cranial cavity and the digestive canal, or in the cranial cavity and the spinal cavity. Sorry, spinal cavity, not digestive. Spinal cavity or vertebral canal. Then digestive juice. Digestive juice are substances that are used in the chemical component or chemical substances that are used in the process of digestion. The lymph is the fluid inside lymphatic vessels. So all these are examples of extracellular fluids. So this table is trying to show how the content of the fluid that is present inside the body is. So here, look at the extracellular fluid is about 80 liters. We are having the interstitial fluid, plasma, and other fluids. So other fluids include digestive juice, CSF, cerebrospinal fluid, lymphs, and other kind of fluids, and intracellular fluids. So intracellular fluid then is the fluid inside the cells. Remember, there are billions of cells in the body, almost about 1 trillion. So the total body water is about 40 liters in an average adult. This is how the distribution of water looks like in a body, in a person with this weight. So the mechanism of the regulation of these body fluids, how these body fluids are regulated. So this is a very complex. A very complex topic. We are just trying to summarize it based on your curriculum. That is why you are just restricting ourselves in just what we found inside your curriculum, so that it will suit you, so that it will be more suitable to you. So we are having diffusion and osmosis. Diffusion refers to the movement of molecules from region of higher concentration to region of lower concentration. So look at this diagram where after the solutes are dropped inside this solvent. The solvent is the substance that in which other substances diffuse or become distributed inside it. So that is what a solvent is. And solute is the dissolvable substance that can dissolve inside another thing is the solute. So after the solid is dropped inside the solvent, so it can easily separate throughout this solvent in such a way that it will reach a level of equilibrium where it will become fully distributed inside it in such a way that it will be found almost everywhere inside. So this is diffusion, and in diffusion both the solid and the solvent are trying to maintain equilibrium. They become mixable, they mix together. It is not that the solvent is the only one to move from one region to another region. It is both the solid and the solvent will try to mix up so as to reach equilibrium. Then osmosis is the movement of water molecules down its concentration gradient towards equilibrium across a semi-permeable membrane. So osmosis, movement of water molecules. Here in osmosis, it is the water molecule that will move from region of higher concentration to the region of lower concentration. So for example, look at these two containers, assuming this is container A and container B. So in this container is having lower concentration of solids, not lower concentration of water. The amount of water in both the two containers is the same, but the amount of solid in this container is low and the amount of solid in this one is high. So now the water molecules will now try to cross this semi-permeable membrane. So this is one of the difference between diffusion and osmosis, this semi-permeable membrane. In diffusion, there is nothing like semi-permeable membrane. So without this semi-permeable membrane, definitely diffusion is the one to occur. But since there is this semi-permeable membrane, now osmosis is the one to occur. Do you understand? Then the water molecules will now migrate from this region to the second region, so that in such a way that the concentration of both the two containers will now become the same. So this is what happened. So now let us try to see the relationship between this explanation, diffusion and osmosis, and regulation of body fluid. Inside the body fluid, remember there are different kind of body fluid inside the body. But remember there are cells. So the content of those body fluids is trying to diffuse throughout the cells and other body tissues. It is trying to diffuse throughout the cell and other body tissues. And remember, the cell has a cell membrane. So this is definitely what happens to the cell and the body tissues. When the concentration of some substances is higher inside the body fluids, now the substance that is having higher concentration in the body fluid will now try to migrate into the cells so as to maintain an equilibrium. While when the concentration is lower in the body fluids and higher inside the cell, now the content of the cell will now try to migrate from the ICF, which is the intracellular fluid, into the ECF, which is the extracellular fluid, so as to maintain an equilibrium. So this is how the body fluid content is regulated in just a simple super summary. We are going to see more information about this when we come to transport across cell membrane. Thank you. These are our references if you want to follow your study. So thank you so much. Thank you for your audience.